Hello everyone, my name is Lailari. I am a student MOT. Um, Today I will be performing an assessment and a treatment for my client, Mr. Jun Ganti. He is a full-time bus driver for 10 years now, and he is presenting a lower back pain, um, a little bit of a restricted motion on bending, and he felt the tingling and numbness on his lower leg that goes all the way down to his toes. But before that, I will be explaining to Mr. Ganti about the benefits and the risk of this treatment. So for the benefits, it will reduce your pain, the stress, and improve your sleep. And also it aids in recovery from injuries and work-related strains. For the risk, the common one, you will have a headache, a body ache. It could last for 24 hours, but it will just go away eventually. For rare cases, it could cause a soft tissue damage and sometimes a stroke, but that's in a very, very rare cases. And when I do the assessments, I might be able to touch your sensitive part or your private part, and you're gonna be okay with that.
Sure.
Okay. So now for the first one, I will be doing my assessment, and I will just gonna be doing a global assessment. So for the global assessment, I would just like you to stand right here, and but because my client presenting a lower back pain and pain on his lower extremities, I will just gonna be doing just the trunk rotation and just the lower extremities assessments for him for the global assessment. So I will just gonna be, or we will just gonna be performing a trunk rotation and a hip circumduction, and a seated and a prone and a supine. So we're just gonna be starting for the trunk rotation. So if you can give yourself a big hug, and okay, and then if you can just turn to your left. Any pain?
Oh, good.
A little bit. Okay, pain, turn to the right. Any pain?
Yeah.
Perfect. Okay, now for the hip circumduction, if we can just do the full rotation and then back. Perfect. Any pain?
No.
Okay, and then back. Perfect. Any pain?
No.
Okay, if you can sit for me, Mr. Dante, I will just gonna be doing a same thing with the trunk rotation, and I was just gonna be using a pillow to put here on his, in between his legs, just to kind of support his body there and for his legs. So okay, if you can give yourself a big hug again. Now I want you to rotate your self to the right. In pain.
No.
Rotate to the left. Perfect. In pain.
No.
Okay, and while you're seated, I was just gonna perform a little bit of a Mitchell's test. Just to kind of do an assessment on his spine. Okay, everything is good. You're a little bit and slightly heated to the right. Perfect. And then if you can move to yep, and forward. Perfect. Yep, and right. Focus is higher than the left. If you can just go in a neutral position for me, please. Thank you. And then while he's seated, I was just gonna do his reflex for my neurological testing. I'm just gonna grab this from you. Doing okay so far?
Yeah.
Perfect. Just gonna check his knee here. See if there's gonna be a good reflex. Yeah, good. And I'm just gonna be doing his cranial here. Good. Same thing with the other leg. Perfect. Good. Okay. This is just kind of like a mix of everything here whatsoever, but so like right now we're just gonna be doing, we were just gonna be doing a sweat glands test. Okay, just try to relax. Okay, so we're just turning that it's all done. I'm just gonna grab it and put it. Everything looks good. Any concern for now? Any question for
No.
me? Okay, no. So now we will just gonna continue and we're just gonna be doing your blood pressure checking. So I did the blood pressure for left and right, and it is all within the normal range. Um, and then if you can stand up for me, I think I know I could do this probably in a while you're in a find or in your phone, but I'll be checking for any varicose issues or any arterial issues. So, on inspection, there is no varicose or any issues noted. So then I will be doing a functional assessment for my client. Then I will ask my clients to go into bed and then just be on your lay on your back. Thank you. And so I will be doing resisted range of motion. And for the range of motion, I was just gonna be doing abduction and adduction for his hip. Like a little bit in here. Doing okay so far?
Yes.
Okay, and if you can just try to close your leg, resist my hand. Any pain?
No.
Okay, try to resist my hand. This is doing the abduction of your hip.
No.
Any pain? Perfect. You don't have any pain?
No.
Okay, perfect. And then for the special test or orthopedic test, I will be doing Faber's test just to confirm my probable or suspected diagnosis. So with the Faber test, I was gonna be ask my client to put his legs up here in 45 degrees or whatever, and then I was just gonna be holding his anterior is I guess here, and then please push it down and then push this. Any pain?
Yes.
Okay, perfect. All right. Okay. And then so now for my treatment, I will be using the GOT to lower body and sacral correction. So for the GOT, we're just gonna be doing a hip rotation, and I'm just gonna flex client's hip, and then flex the knee as or no, not flex the knee, just put on the knee in this position, and then I'm just gonna rotate this for 7 times. 7, and then I'm just gonna drop it off and then see the vibration of his body. Any pain?
No.
Okay, let's get a bit one more time. 1, 2, 3, 4, 7. Pain?
No.
Nope. Gonna be doing on the other side, just to kind of make sure that everything's okay for both legs. 3, 4, 5, 6, 7, and drop. Doing okay?
Yeah.
Any pain?
No.
Time. 2, 7, and then all good?
Yeah.
Okay. If you can just flip over and lay on your stomach for me, please. Everything's good so far?
Yes.
Okay. So now I will be doing a sacral collection. So you can give a little bit. Perfect. That's it. That should be so good. Now try to relax. Just gonna be putting his control system here. Okay, and we can um, go up and do a sound extension for me. Okay,
No.
I kind of noticed that you right from here is a little bit elevated compared to your left. Okay, now we can go back down. Just gonna do it one more time, just to kind of make sure that we get everything correctly. Perfect. Okay, nothing changed. Okay, now you can just go back. And now, because of that, we will just gonna be doing that circle direction. Because my client, I have noticed that he has a depressed inferior lateral angle on extension, so I will just kind of wanting to correct that one if possible. So I'm just going to ask my clients to stay on the neutral position and then turn to the left. Perfect. Oh, sorry, like your head on the left, and then I was just going to be asking my clients to kind of take a deep breath, and then yeah, and then inhale, exhale, breathe. Perfect. Breathe one more time. Perfect. Alright. Now we're just gonna now put yourself in a neutral position again, and we're just gonna do the reassessment. I was just gonna be asking my clients to doing a extension again and see if there's any changes. Okay, now you're good. It's now it's all even, it's still the same.
Okay.
Okay. Perfect. So with my client, because of the signs and symptoms that he is presenting, my client is possibly having a sacroiliitis, which is kind of like similar to SI joint dysfunction. So some treatments for the assessment might be a little bit different, but as for my assessment, it is leading to that condition. So do you have any questions for me for now?
No.
Okay, thank you so much, Mr. Ganti, and I hope to see you on the next treatment schedule.
Okay.